The American Health Front is a presentation of Medical Media Group and the following physicians and healthcare organizations.
Hello everyone, I'm Ernie Bjorkman. Welcome to the American Health Front. The purpose of our program today is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special Los Angeles edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could really change your life. When most of us think about the male chest, we think of muscles and definition. But for some men, this is not the case. Sometimes the male breasts become enlarged and can begin to sag. This is known as gynecomastia. Board-certified plastic surgeon Dr. Joseph Cruz of Cruz Plastic Surgery has dedicated his life to the art of cosmetic surgery. He tells us that an effective choice for many men with gynecomastia is male breast reduction surgery.
Gynecomastia is a unique mixture of cosmetic and reconstructive surgery.
My nipples were kind of protruding. There was some extra tissue back there, and it had caused me large amounts of discomfort.
Now Dr. Cruz explains how the surgery works.
Gynecomastia typically consists of an excess of both fat and breast tissue. Adequate treatment of gynecomastia usually requires removal of both the fat and the breast tissue. Excess fat is removed by liposuction through a small hole on the lateral aspect of the chest. Liposuction, however, does not remove most of the excess breast tissue. This excess breast tissue usually requires surgical excision. This is done through a small U-shaped incision along the bottom of the areola. The breast tissue is then separated from the overlying skin and the underlying muscles. The breast tissue is then everted out of the chest wall. It is then removed in a meticulous, precise fashion, making sure to leave a normal amount of breast tissue behind. Removing too much will create contour irregularities. However, removing too little will not correct the problem. At this time, the skin and nipple area are then sutured back down to the underlying muscles. This encourages the skin to heal in a smooth fashion.
I had the gynecomastia procedure through Dr. Cruz's office, and it's changed my outlook on life completely. It's been immensely positive for me.
Cruz Plastic Surgery, where surgical precision and modern technology meets passion.